A bone marrow transplant can be a life-saving treatment for certain types of blood cancers and other severe hematologic or immune disorders. However, patients are left with a compromised immune system and a higher risk for severe infections. Though antiviral medications are available for some of these infections, they are expensive, associated with significant side effects, and do not work for all viruses. New research from scientists and clinicians in the Center for Cell and Gene Therapy at Baylor College of Medicine, Texas Children's Hospital, and Houston Methodist Hospital have unveiled a safer and more effective approach to rapidly target these viruses. They are using a novel immunotherapy developed at the center's state-of-the-art laboratory in the Texas Medical Center. In a recent issue of the journal Science Translational Medicine, the team published results from a clinical study using this therapy in patients who have received a bone marrow transplant from a donor. Dr. Ann Lean is the senior author on the study.
So what our therapy does is just really put back the immune system. So that's why these viral infections are a problem in these patients. They essentially don't have an immune system of their own to fight infections. And what we're doing is growing an immune system for them and then putting it back.
Scientists and physicians in the center have pioneered research into the use of this process called adoptive T-cell transfer, which uses virus-specific immune cells called T-cells. The T-cells are grown in the lab and specifically trained to attack the viruses that cause infections. Lean described the process, which takes only 10 days. In previous studies, similar T-cell products have taken as long as 3 months to manufacture.
For this process, the first step is to draw blood from the donor, and this is the same donor that will be the donor for the stem cells. And in this case, rather than stem cells, what we're interested in isolating are immune cells called T cells, and these are the immune cells that healthy individuals use to fight infections all the time. So all we do is isolate these immune cells and then expose them to different components of the viruses that we're trying to train them to target. So we stimulate them with what we call peptide libraries. So these are synthetic reagents which are derived from these viruses that we're trying to train our T cells to recognize. All we do is we isolate then our immune cells, expose them to these viral components, put them in growth factors and nutrients that the T cells like to grow in, and then we pop them in the incubator for 10 days. About midway through the procedure, we just monitor them to make sure that they're growing as we expect them to do so. If we feel that they need more growth factors, we add those growth factors at about day 7 of culture. And then on day 10, we harvest the cells, as Fatma is doing now, and we freeze them down in aliquots that will be suitable for administration to the patient. So once we finish this process and freeze these cells and put them in our freezer bank, at the time the patient needs an infusion of the cells, what we will do is go and take the vial of cells, a little cryovial of cells, take them to the patient's bedside, thaw them out, and infuse them directly to the patient.
This clinical study focused on 11 patients who had received transplants at either Texas Children's Hospital or Houston Methodist Hospital. Using this new T-cell therapy, the virus protection results were significant.
What's unique about this study is this is the first time any group in the world has made cells in just 10 days and adaptively transferred them and shown this level of efficacy that we're seeing. So we targeted 5 viruses with 1 product, and we saw a 94% response rate in patients who were treated. And what is novel about this study and different from other studies is, yes, we targeted 5 viruses, but for the first time ever, 2 of these viruses, it was the first time they've been targeted using T cells that were generated in the lab. So for BK virus and HHV6. And both of these viruses are very prevalent, very frequently detected in patients after receiving a bone marrow transplant. And although there are antiviral medications out there that people will use, the physicians use to try to keep these infections under control, generally the activity of these antiviral agents is not good.
The findings signify that T-cell therapy could be an available option for more patients and provide long-lasting protection. And for many of the center's scientists, the connection of their research to the patient is particularly rewarding.
It is amazing. I mean, we have treated patients from all over the world, because some patients come here to get their transplants. They're a little bit complicated, and you get to see them, and I mean, it's quite affecting because they're putting all their hope on you. Right?
This study is one of many conducted by researchers in the Center for Cell and Gene Therapy using T cells to not only attack viruses in transplant patients, but also certain types of cancers associated with the immune system, including lymphoma and leukemia. They continue to provide groundbreaking new research in immunotherapy and are working to make T-cell therapy more broadly available to patients.